health experts pushed for pregnant women to be considered high priority to receive the vaccine. And while many pregnant women jumped at the opportunity, others were hesitant to take the vaccine. Being pregnant myself, it's a big decision. It's not just my body, but it's the body of my unborn child as well. What do you have to say for pregnant women that are still deciding whether or not to receive the vaccine?
I mean, the first thing I say is only the pregnant woman herself can decide what she thinks is best, because to state the obvious, I mean, she's got obligations and feelings that go beyond just her own body. She's carrying the life of another person now. And, there's going to be different reactions. And look, early in the pandemic, as I followed this, and I'm not an expert in this domain, but there was a lack of information for pregnant women. It just wasn't clear. And they were saying, well, at this point, just don't do that. Later in the pandemic, like such as the last few months, the advice is you're far better off being vaccinated. I think families have to be as supportive as they can to pregnant women. I would suggest that they get as much medical information, because there's a lot more than there was a few months ago.
Yeah, big decisions for parents. And Pfizer has announced that their vaccine is now safe for children as young as 12 years old. And parents are facing another big decision. What do we know about vaccines in children?
So I'm not a vaccine expert. I do follow these things, and all indications were that there wouldn't be much difference for young people. I'm speaking now of the age group that you described, 12, not small children. The thinking was there probably wouldn't be that much difference. But look, the risk-benefit analysis is different when you get down to 12-year-olds, because as we know, COVID-19, not exclusively, but tends to affect more seriously the older a person is. So the risk for young people within that age group, let's say 12 to 16, is lower. But still, you've got asymptomatic transmission. It does make sense. What I see as a challenge in Canada, because we have so much variation, from province to province and territory to territory with our consent laws. Remember, some provinces and many provinces actually don't have an age of healthcare consent. So what I mean by that is a healthcare worker would deal with a patient directly, whether she is 90 or 12 or 13, to see if the patient before them understands and appreciates. So it's not as if everyone above or below a certain age, and that is true for some provinces. Quebec, it's 14. I don't remember the ins and outs of every province. But look, you could find yourself within your own family life in a position where the children have a different opinion as to whether they do or don't want a vaccine than their parents. And I don't think that's going to happen very often, but it may very well happen. And I think, families are going to have to be as respectful to differences amongst themselves as they can possibly be.
Mm-hmm. Yeah, it feels like nobody can kind of escape these conversations about vaccines. It's all around us. How do we navigate these conversations with friends, with parents and siblings and coworkers without it becoming angry and divisive?
Well, not very easily. Lecturing at people tends to not work. So if a person is very concerned about vaccines, just sort of barreling at them throwing a lot of facts at them, it's probably not the best idea. I mean, you'd want to ask why they make tell me about why you think what you think. And, if a person's drawing from things that aren't scientific, if you can, you may be able to point that out to them. But generally, this thinking that if someone is vaccine hesitant, all you need to do is sit them down and give them a long-winded science lecture. It's not actually true, in which that doesn't tend to change behavior. What does tend to change behavior is when people feel safe and comfortable, and they see people that they admire and respect, whether that's within their own family, colleagues, professional people, that are getting the vaccines. That's when behavior, not in all cases, but will change.
Mm-hmm. Now, what do you think of this idea of a vaccine passport that's kind of being talked about?
Ethically, very, very problematic. But let me say this, vaccine passports is a big difference as to whether we're speaking internationally or domestically, meaning nationally. So internationally, look, whether we love it or not, they are coming, they're imminent. And when I say international, that means, of course, to be traveling to other countries. And we already have variations on that. I still see that as ethically problematic, because in this approaching summer of 2021, The people, if there's vaccine passports, and there probably will be, the people that will be able to travel around the world are people from high-income countries, because people from low-income countries have had virtually no access to vaccines. So right away, you've got an injustice within that. But having said that, the airlines, the countries many are increasingly saying we need to do this, and we will. When we look inside our country, much more ethically problematic, because look, freedom of movement is a fundamental democratic right. Now, we don't talk about it that much because we've always had it. But freedom of movement means you can go where you want for lunch, and your life is your own. Right? But if you're not vaccinated, remember, theoretically, if it comes to this, you may not be able to go to that restaurant for lunch. You may not be able to go to a basketball game. You may not be able to go to a movie theater. So, is that really fair in that way that we've got two groups of people? Also, with vaccine passports, they will have some identifying information, and there will be a kind of if they're electronic, which they almost certainly will be, there'll be an app. There'll be an element of surveillance to that. So if you go out on the weekend for dinner, whatever you might choose to do, those movements could be tracked. Some people are going to say, I couldn't care less if anyone wants to track my movements on a Saturday afternoon. But when you really think of it, in a democratic, free society, no one should really be tracking our movements at all. Our lives are our own.
And, heading into a summer and people kind of trying to plan vacation time, families especially, what is our ethical responsibility when it comes to planning vacation and moving around?
Well, we don't know yet, because I'm in the same position. I need to get going internationally, and I'm not doing anything until it's legal and safe. So we just don't know yet. We're waiting on public health recommendations. It does look like the vaccine rollout in Canada has really accelerated over the last few weeks, and if things continue to go well, don't have a crystal ball, things should start to get a lot better very, very quickly, especially when we get into June and July, the real summer months. So we don't know. But look, there's many Canadian families, and I'm in the position myself that, by now we probably would have been booking things and making plans, and you really can't responsibly at this point because you don't know if you're going to be able to do it or not.
What are your thoughts on provinces pausing the AstraZeneca vaccine?
I do. I'm one of these people, right? So I'm AstraZeneca. My thoughts are this, and I'm afraid they're not very positive. Is the pause of AstraZeneca, or the cancellation of AstraZeneca, whatever we're looking at, what is driving that? Is the decision, is it scientific? Is it supply? Or is it essentially, it's become a public relations nightmare? My take is it's actually all three. And, I've had my first dose of AstraZeneca. So for someone like me, I'm not really losing sleep over it, but I'm sure some people are. I don't know how this story ends. I don't know if I'll be able to get another dose of AstraZeneca, if I'll, with no choice, have to accept a blended dose of something else. I don't know. And, uncertainty is what really breeds, people's hesitance. And I worry that this very difficult situation that Canada's had, and so much back and forth on AstraZeneca, has really eroded a lot of Canadians' confidence within our overall vaccination system.
Well, Dr. Bowman, thank you for joining us and for offering some help with this.
Okay, thank you.